Hi friends, I am Shoham Bera, Senior Consultant Optometrist. Today I am going to tell you about the general instruction for post-operative patient after eye surgery. It may be eye cataract or another eye surgery. With cataract surgery, most patients experience little pain or discomfort. During cataract surgery, the cloudiness nature of the lens is replaced with a artificial lens called an intraocular lens or IOL. Cataract surgery is the only way to remove cataract from your eye in order to restore your vision. However, as with all surgery, it is possible to experience short-term treatable side effects or other complications as you recover. If you experience severe complications, redness, light sensitivity, pain or loss of vision, you should contact your eye hospital or eye specialist as quick as possible. Friends, first protection is a eye shield. Please use a eye shield for proper protection when you sleep night or in the evening. You may use operative dark goggles or clear goggles during daytime or nighttime. Please wash the eye shield and goggles before use. You clean it into the water and soap and dry it, then use it. Okay? The second is washing the face. How to wash your face? Cleaning of the operative eye will be as per the instruction given by your eye specialist or hospital staff. The rest of the face can be mopped with a clean and wet cloth. Do not splash water in the eye directly. Third, shaving for male patient. Shaving is permissible, but avoid splashing water directly into the eye or into your face. You can mop it within a cloth. 4. Bathing. You can bath below the neck from the first post-operative day itself, but avoid head bath for a period of 3 to 4 weeks in case of SICS, small incision cataract surgery, and minimum 7 days for phacoemulsification or phaco. Use of facial cosmetics. Avoid any cosmetics to the eye such as mascara, kajal, surma, any eyeliner, nothing, and at least for 3 to 4 weeks. Now, physical activity. Activities such as walking, talking, TV viewing can be resumed immediately after the surgery. However, jogging, swimming, gardening or contact sports etc. may have to be avoided at least 3 to 4 weeks after surgery. Driving. Avoid driving till 3 to 4 weeks when your consultant specialist will give the permission, and then you can drive your car. Second, join back in your duties. Usually you will be allowed to join your duty 3 to 4 weeks after surgery, depending upon the surgery. In case of phaco, you can join your office after 3 to 4 days also. It depending upon the surgery, which procedure is done with you. You may resume your sexual life in a week or 2 weeks after the surgery. The following symptoms may be expected after most surgeries. Some amount of redness, watering, foreign body sensation and glare are common. The severity varies with the type of surgery. The symptoms will reduce within 3 to 4 weeks or within 2 to 3 days. It depends upon the type of surgery. If you have any worsening of these symptoms, redness, blurring vision, foreign body sensation, pain, go to the emergency counter of your eye hospital or ask eye surgeon, eye specialist, what to do. Now, the procedure for cleaning the eye. The operated eye need to be cleaned at least twice a day in a morning or an evening. The attendant or your family member performing this task, he or she should be hand with soap and water, and he can use also hand sanitizer and dry them with a clean towel. You may be use disposable tissue supplied from the hospital. Procedure for cleaning the eye. The operated eye need to be cleaned regularly twice a day, in the morning and the evening. The attendant or your relative who performing the task should wash the hand with soap and water. He or she may use hand sanitizer also and dry them with a clean towel. You may use disposable tissue supplied at the hospital from this purpose, and you can use fresh cotton ball for this purpose also. Now the major part, installation of the eye drop. The attendant should wash his or her hand with soap and water. The cap of the eye drops bottle is opened very carefully without contaminating the tip or the nozzles. Pull the lower lid and place a drop between the eyeball and lid margin in the pocket. And by the squeezing the bottle cap as the case may be. Wipe away excess medicine or fluid which comes out from your eyes after installing the drop with a clear or clean cotton or clean cloth. After installing the drop, you should be close your eyes at least 2 to 3 minutes. General instruction for installing medicine in the eye: always instill drop before any eye ointment. Leave a gap of minimum 2 to 3 minutes between two medication. Keep the eye closed 2 or 3 minutes after applying the medication. Once open the eye drop are discarded after 1 month. Replace the cap and the bottle immediately after use. Make sure the right drops are being used at the right time. If similar medication is advised for both eyes, it is advisable to have separated bottle for 2 eyes. Unused eye medication once opened is discarded and never be used for other person. Now the general instruction: do not rub your eyes with your hand or anything. Do not lift heavy weight. Do not allow the eye to get injured. The eye shield is meant to protect the eye from any physical or blunt trauma. Avoid too many visitors for fear of contacting infection. Especially avoid visitors with conjunctivitis or any eye disease, redness, or anything is happened to any visitors. Avoid them. Do not play with children, since there is a possibility of getting any trauma in your operated eye. Avoid use of snuffs. Cigarette smoking should be avoided. With alcohol beverage also be avoided. Avoid using handkerchief to mop the eye. Use sterile tissue or cotton ball to mop your eyes. So friends, be safe and stay healthy.